Good morning. Today is Saturday, July 29th, 2023. This is our regular Saturday morning yoga therapy class. As you all know, it used to be in person before the pandemic, and after the pandemic it became virtual, and we're continuing virtual. Now I need to check a little bit the sound, check. Let me see here. Okay, sound is good, and we should begin. It's almost 9:30. Now, today's topic is, again, another request. We are going through all the requests now based on the ailments. Today's ailments, the request was the asthma. Definitely, asthma is yoga therapy is a powerful tool for asthma. In fact, we have a very famous yoga therapy teacher in this area, in Washington, D.C. area, who was suffering very much from asthma, and with the yoga therapy, he's completely cured. And that really brought him to the world of yoga therapy, and he's one of the almost world famous yoga therapy teacher. Also, as you know, our presentations are all this is based on our experiences. As usual, when they start a topic, especially an ailment, we as a physician, we first start with the pathophysiology. What is the pathology and the physiology behind the disease, and then what is the treatment. The asthma basically is a symptom-wise, all of you know, it's a shortness of breath, cannot breathe. The underlying pathology is that the branches of our trachea, like our main lung, the respiratory channel is our nose, then is our sinuses. There is on the side of the nose is called turbinate, going back of your throat, goes to your larynx, trachea divides into two bronchi gets into branches called bronchioles, like branches of a tree. The bronchioles ends up with a small sac called alveoli. In the alveoli, one side is a blood vessel, other side is a blood vessel. The other side of the blood vessel of alveoli in the lung is the blood carrying the carbon dioxide, or what we call the unsaturated or desaturated blood, or we call it basically removing the waste product. And in the sac in the lung is your oxygen from the air, and they get exchanged. So the oxygen goes through the membrane, or called the sac, to the blood in the hemoglobin, which carries the oxygen to the rest of the body. And from the hemoglobin, we call it a desaturated hemoglobin. The carbon dioxide and other products we call it end products of metabolism, comes out, and then comes out through your breathing out, expiration. What is interesting is the volatile substances, the substances emitted by the underlying ailment or underlying the disease, this comes out through your out breath, exhalation. By analyzing that exhalation, out breath, we can literally diagnose hundreds and hundreds of diseases. Because you know, the dogs are expert in diagnosis. Same as cat, you know. We call it a CAT scan. The cat, dog, they can smell you and do a diagnosis, including cancers, including multiple your metabolic disorders. So the bronchiole, the channel which ends up, or the smaller channel which ends up into the alveoli, they constrict. They constrict to an impulse of autonomic nervous system. And also there is an inflammation inside the lining of the bronchiole, and then from the inflammation there is a secretions inside the bronchiole. So if you look at a channel, which channel is already constricted, then you have an inflammation, and one of the component of inflammation is swelling. You know, the redness, swelling, pain, those are the signs of inflammation, swelling. Then from the inflamed bronchiole, you have the secretions, like, you know, when you expel out, we call it cough. So all the three combinations are blocking this. So when you try to take a deep breath in, as you know, breathing in is active. You can breathe in. Our breathing out is passive. So in asthma, the problem is the breathing out. They can breathe in, they have a hard time breathing out. So you have to train them how to do a longer exhalation. Lung, as you know, lung and heart is the same organ, and they're very sensitive to emotions. And if you scare somebody, fear will happen. Heart rate will go high up. Or when your mind quiets down, heart rate comes down and the breathing also comes down. If you scare somebody, the breathing rate will go higher. In fact, when you see something beautiful, what do you call it? Breathtaking. Yeah, I'm looking at a beautiful mountain. This is a breathtaking. In Ayurveda, it's called a tridoshik. Tridoshik means the constriction, the movement is called vata disorder. The inflammation in the mucosa is called the pitta disorder. And the secretions are called your kapha disorder. So the vata, pitta, kapha, so they are called tridoshik. It's a tridoshik disease in Ayurvedic concept. The causes for this, in Western medicine, it is also first described as a genetics. But as we know today, there is nothing called genetics causing disease. We have a genetic mutation. I have a genetic mutation for every known ailments you can think. I have a genetic mutation for thyroid cancer, diabetes, hypertension. But the cause the disease, the gene has to express. Genetic expression causes the disease. And the genetic expression is controlled by what is called your epigenetics. Very simple. So epigenetics is basically what yoga therapy is. Epigenetics is your lifestyle. So the genetics is a main component for asthma, but gene has to express. Second, what we find out, the emotion has a trigger for asthma. There was incidents like there was a mass shooting in a school, and the fear caused many students an attack of asthma, especially people who have underlying asthma. The students, they had an acute exacerbation with the emotion. We have seen at home children having asthma, the parents are having a little argument, the children doesn't like what the home environment or the conversation of the parents, they get into an attack of asthma. But most important of cause of asthma is obvious, is an allergy. You say allergies to your external environment, and as you know, allergy is an expression of our immune system of your hyperactivity. When an external pollutant comes, body responds with your immune system. So it starts a cascade of phenomena, including we call it a histamine release, bradykinin, cytokinin. You can go through all about this, inflammatory response, and it causes the sequence, the inflammation of the lining, bronchospasm, and the secretion. Environment, obviously, also one of the most pollutant of the environment is your smoking. Smoking is another root cause of your asthma. Then your environmental pollution, where you live, and a lot of lifestyle related disorders. And primarily we call it obesity. People with obesity do have a little higher incidence of asthma. So what is the therapy? From Western medical standpoint, we use what is called a bronchodilator. It opens up the bronchioles, and it comes in all different forms. It comes with a little puff you can take. You can take it oral, or in a severe attack, you have to give it intravenous. So let's see what our yoga therapy has to offer. First, it is a lifestyle related disorder. It is an epigenetics. Daily routine, dinacharya, extremely important for treating asthma. One very interesting thing we teach, you may try. You may memorize a poem, or memorize few lines of a book, or memorize anything, whatever you say. And then you recite that as long as you can. The longer the recitation effortlessly is, the longer is the exhalation. Because the asthma people with asthma cannot do the exhalation. So teach them, okay? Read this poem, memorize it, close your eyes, recite that poem in one breath. Try it. You will like it. So in a daily routine, say when you get up, you sit down in called a malasana, squatting pose, you drink a glass of water, then we have our bowel movement, then you brush our teeth, then your tongue scraping. People with asthma, we recommend do a tongue scraping. When you do tongue scraping, your tongue gets clear. What does tongue has to do? You'll be surprised. A clean tongue, uncoated tongue, very effective for efficient breathing. So these are the things we are lacking in Western medicine. Western medicine is reductionist. Oh yes, the air goes through your nose, and you have to keep your nose clean. Yes, you have to keep your nose clean. But amazing that whole this area are all connected. This is called holistic approach, whole. So we have a bunch of tongue scrapers. I keep it, I collect it, so I show it to you. You might use them. A very nice tongue scraper is, it comes in all different metals based on your Ayurvedic body type. Brushing your teeth, take a brush and brushing your tongue really doesn't help. One very simple one is just still. You go to the back of your tongue and slowly scrape it out. Don't do all the scraping. Somebody came in and said blood was coming out. Lot of news, interesting stuff. There's one called a copper. Copper is being known in practice of yoga as being a metal of. It's another whole day presentation. Copper, you will see all in yoga is a copper glass, copper neti pot, copper. In fact, in just Western concept, copper is a bactericidal, virucidal, but copper has a lot of other properties. I know one of our hospitals is using the copper infused or copper infiltrated their linens, pillow cover, bed cover. It's wonderful. I get this thing and I collect. There's another one. It's a beautiful copper. Look at this one. This is a wonderful copper, and this one you can adjust in different ways. So, tongue scraping is a must for people with asthma. Then comes your. And all these things, neti pot, gel neti. Gel neti is absolutely must for people with asthma because gel neti, as much as it cleans up your nostril, it also takes out the irritations. That means all the excitement you can think about goes away. So you can go to my YouTube channel, you can see all the gel netis, or go to my presentation daily routine. See, so we fill it up with a little lukewarm water. We put a 3 pinch of salt, non-iodized salt. We put it in one nostril. Close our eyes, breathe through our mouth, turn our nose, and the air comes out. We do the same thing on the other side. You blow our nostril, and then do a little Kapalbhati pranayama, because there is some water gets left into your sinuses, which comes out, and also I do a little hitting in your forehead. There's a frontal sinus, and the water comes out. And there is a very nice lot of other this is one made of copper. As I said, it's a copper we call neti pot. I would prefer a porcelain one. Initially, you can put a little bit of maybe little Vaseline to just lubricate, so it goes easily in your nostril. And once you get used to it, and then putting a salt, not a salt initially takes out the irritation. But what it does also, when you put in the nose, oh my God, you have so much of irritation. your whole face gets flushed, cannot breathe. But if you keep on doing it slowly and slowly, as you know, neuroplasticity sets in and the irritation goes away. When the irritation goes away, the concept of yoga is voluntary control over involuntary function. Basically means you are able to control your autonomic nervous system. Very, very important concept. Personally myself, I also have a plastic one, which I don't recommend for any of you, but I carry the plastic one when I'm traveling. And as far as my practice, doesn't matter where I am. I'm in the train, I'm in the plane, I'm in a hotel, I'm in a friend's house, I'm this house, where never. I don't think I've ever missed a single day of not using a neti pot, my nasal washing in my daily practice. Sutraneti. Sutraneti is called a sutra is a thread. Thread neti. I'm not going to show it to you. Don't get scared. It is originally it used to be a thread called sutra, but now we use a red rubber catheter. It's a 12 French red rubber catheter. Generally, initially, we put a little oil in it, and then we put it through one of our nostrils. So initially, when you bring it to a nostril, you get all irritation. Oh, I started sneezing, coughing. But slowly and slowly, when you bring it up, you lose all this, we call it a voluntary reflexes. So the control over reflexes, slowly keep putting it in, and essentially it comes out through your mouth. You hold it and literally you floss it, like you're flossing your nose. It may sound gross, it will look gross, but you do it. You are in a profound level of relaxation. It's a relaxation response. If you tightens up, when the channel gets tightens up, this is not going to go through. And same as the water. When you put your water in the nostril, you have to keep your eyes closed. Open your mouth, breathe in and out, and totally be relaxed. And the more you relax, the whole water will come out through other nose like a stream. Take a look at one of my presentations, you'll see. But even when it is tight, we're going to go through. And remember, in excitement, when you're excited, the mucosa inside the nose also gets swollen. It is called a sympathetic response. Because you need a parasympathetic response for proper breathing and proper respiratory function. So that sympathetic, even swelling of the mucosa inside the nose also prevents your breathing. Another profound relaxation is called washing your stomach, called Vamandhoti. Vamandhoti is you keep drinking 2 glasses of water. You can put a little bit of a salt sometimes, it helps. Again, 2 glasses of water. Again, 2 glasses of water. You feel. When you feel your complete stomach, you bend down, and I have shown you before, you bend down and touch back of your throat or like a soft palate. Water will come out. It is called a Kunjal Kriya. It's a Kunjal Kriya means water will come out like an elephant. When the water comes out, that comes out as a relaxation response. All my gastroenterology friends says, yes, it's a retching, it's a vomiting. It can cause a tear. It is called a tear in your gastroesophageal junction. The junction between esophagus and stomach is called a Mallory-Weiss tear. Yes, we know all about this. But this is not a contraction of the stomach. It is not the tightness pushing out. Primarily, it's so relaxed that your whole channel, your whole esophagus to the stomach, it becomes like a one new, beautiful, dilated channel. I'm sure you have seen all these, circus people, they do a sword swallowing, they put the whole steel through your stomach. Yes, they do. Why? Because the whole esophagus is so relaxed, so dilated, it becomes like a one big channel. What else? Oh, you can do it also called a Bastrodhoti. You can keep drinking, keep swallowing a piece of cloth. And it's a very long cloth. I have it somewhere. I cannot find it. Okay, keep on swallowing. It goes into the stomach. And the stomach, you sit down, very quiet, and slowly pull it out. You'll see all the bile is coming out. So basically, it's a relaxation response which helps in your therapy for the asthma. Dandadhoti. Dandadhoti is you keep drinking the water, stomach is full. Then you put this through your mouth, and this is a little bigger rubber catheter. It goes to your stomach and it comes out like a siphon. People think these are all gross things, but this is a wonderful, wonderful practice. So, in a asthma therapy, it is a problem in the lung. So therapy is primary pranayama. Pranayama is a voluntary regulated breathing. Prana is the life force. Prana is a subtle energy which keeps us awake, alert and alive. Our breath is not the prana. Breath is the carrier of the prana. Prana is like an electricity, and our breath is like an electric cable. But if you start doing a pranayama in a patient with asthma, they are not able to do a breathing. Why not? Because they try to do a breathe in, because they cannot breathe out, try to do a breathe out. When you're breathing out, you can listen to a stethoscope. It's called your wheezing. You can hear the sound. So they get afraid. So they get so afraid, they get anxious. And this is called your 5 koshas. First koshas is our physical body, Annamaya kosha. Second is your breath, Pranamaya kosha. Third is your mind, Manomaya kosha. Fourth is your intellect, Vijnanamaya kosha. And fifth is your bliss, Anandamaya kosha. So think about it. A person physically who has a constriction, tightness of the bronchiole causing asthma, having a second layer of the sheath problem, which is called your Pranamaya kosha, that means you have a dyspnea, breathing problem. So when you have an effort in breathing, you get so anxious, it affects your third kosha, called your mind. You become very anxious. So I'm telling all these things to you so that you can figure it out and formulate a yoga therapy based on the tools you have. Because most of you are a very seasoned yoga teacher, yoga therapy practitioner. Once I give you the basic pathophysiology, give you the basic understanding, you'll be able to do it. So from the constriction of the bronchioles, you get a breathing difficulty. Now your mind has an issue, you are very anxious. When your mind, then you lose your intellect. That means you don't know even what to do. You lose your rationality. And when the intellect goes down, then you lose your bliss, Anandamaya kosha. So on the other hand, if you quiet down your mind, which we call the limbic system of your brain, which is our emotional brain, amygdala and hippocampus. Now your intellect in balance, then your mind will be in balance, then your breath will be in balance, then your physical constriction will be in balance. So guess what will be first therapy? First therapy will be for any patient who comes with the asthma. Please, please, don't push them any asanas, don't push them any pranayamas, don't push anything, they will just run out of your room. Let them sit down. Sit down in a chair. You don't even want to put them in a seated in the ground. Don't even do any asana poses. Sit down in the chair with your spine straight. I'm sitting on my kneeling stool. As you know, all the kneeling stool I have has keep your spine straight. Sit down with your spine. Sitting in a chair keeps your spine straight. Let me sit in a chair and let me show it to you. You might see it a little bit better. You sit in a chair, start. This is the beginning of your asthma therapy. It's a very, very important concept. Once you start relaxing, then you start relaxing your upper part, they call muscles of respiration. And think about it, another concept, a hand strength. Hand is connected to your respiratory system. Improving the hand strength improves your breathing. So, say hand strength like asanas, like you call tulasana. Sit down in a padmasana, lotus pose, put your hand and raise your body high up. Bakasana, crane pose. Mayurasana, pickup pose. Mayuriyasana, female pickup pose. So sit down with the spine straight. I will have shown it to you how to sit down spine straight. I have shown it to you, body is a 90-degree angle. Touch your index finger and thumb. Dhyana mudra or Jnana mudra. Quiets down your mind. Then quiets down your mind is your controlling your five senses. I hear, I see, I smell, I taste and touch. Shabda, sparsha, roop, rash, gandha. Vision is the most powerful of your five senses. Close your eyes. If you pay attention to your breath, if you think like a normal person starting pranayama, what do we say? Breathe out first. Take a slow, long breathe in without any effort. And breathe out longer than breathing in. Asthma patient will run away from you. Asthma patient will not be able to do it. They need to quiet down their mind, so we teach them first is your chanting. Teach them first a vibration. What is a vibration? Our brain is in a state of vibration. We create another vibration which is the same frequency, two frequency interacts, cancels for a harmonic resonance. We do a first chanting called a Om chanting. Then we do called a Brahmri pranayama, bumblebee breathing. Then do your bumblebee breathing with your prayer pose to the back, Paschim Namaskar, with the relaxation of the neck called Brahma Mudra. So here is that practice. Spine straight, eyes closed, hand in a Dhyana mudra or Jnana mudra. and a continuous slow Om chanting. Take a deep, slow breathe in. Then to pumping and cupping, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hands, if you're wearing glasses, remove your glasses, take the hand, put it over your eyes like a cup. The heat relaxes your eyes, the ciliary muscle gets relaxed. Your lens became more convex. Eye supplied by the 4 cranial nerves, SO4, LR6. Superior oblique is supplied by the 4th cranial nerve. Lateral rectus muscle supplied by 6th cranial nerve. Retina is supplied by optic, and outside is the trigeminal nerve. Massage your forehead. All the muscles here are attached to your skin. When the muscles are relaxed, the frowning goes away, the line goes away. Same thing in your face. All the wrinkles goes away and feel, looks like a rejuvenated. It looks you are very young looking. Massage your earlobe, behind the ear, in front of the ear, in fact sometimes inside the external auditory canal. There's a branch called auricular branch of the vagus nerve. They call vagal activation, which is parasympathetic activation. Hand comes down, massage the side of your neck, called massaging the carotid sinuses. Massaging carotid sinuses, quiets down and relaxes cardiovascular system and nervous system. Take your hands behind, massage close to the occipital tubercle, the 2 muscles, sternomastoid and trapezius, both are supplied by cranial nerve. Wonderful experience. Once you have done this, then you do the relaxation responses. And as you know, the hand gets relaxed with your called Balu Mushti Mudra, like the way the baby closes the hand. This is called your Balu Mushti Mudra. Balu means baby, baby fist. But also, when you touch your index finger and thumb, put it over your knee like this. This is called your Dhanu Mudra or Gyanu Mudra. But if you touch your index finger and thumb, turn your hands down, put it over your knees, it's called a Chin Mudra. It opens your lower part of your lung. If you close the other fingers, this is called a Chinmayi Mudra. Chinmayi, it opens the middle part of the lung. And then when you put your thumb inside and close, it is called your Adhi Mudra. It opens the upper part of your lung. So opening all the parts of the lung is also very important with your chanting. So this is called your Pranobho Pranayam. A Pranobho Pranayam, what you do, you use the 3 component of Om. Om has 3 components. A, U, M. A, U, Ma. To use the M during your expiration. So all you are trying to create a relaxation response and coming down your mind so you can prepare this person with asthma for pranayama and asana practice. It might take some time. It's not going to happen overnight. So take your time. So Pranabha Pranayama, sure, starts with your first chin mudra, the index finger and thumb, and palm facing down. The first component is Ah. It will come from the lower part of the lung. So breathe out first. You will take a deep breath in and breathe out with the sound of an Ah. Chin mudra. Close the other fingers. Now we're doing the Oo. Oo opens the middle part of the lung. It's called Pranabha Pranayama. Breathe out first. Deep breath in. Third is the upper part of the lung with the Adhi Mudra or a Balo Mushti Mudra, thumb inside and close. It is so relaxing that we recommend everybody to even all the asana practice, pranayama practice with the Adhi Mudra. And this sound will be Ma, A, U, Ma. Breathe out first. In a Brahmari Pranayam, in a bumblebee, put your index finger in the forehead, and you have seen all this stuff, I've shown it to you before. You can put a Shanmukhi Mudra, or you put a 3 fingers to close your eyes, thumb to close your ear. You're breathing out first, breathe in and breathe out, sound of a bumblebee like a bee. Breathe out first. You can incorporate this sound of a bumblebee with the first relaxation of the upper part of the body. And as you know, yoga therapy is not a reductionist. Relaxation in the upper part of the body relaxes the rest of your body. relaxation of the hand, thumb inside, relaxation of the wrist, extension. I've shown you every single day. Do with your breathing. Breathing in, breathing out. Relaxation of the shoulder. You can do a relaxation of the shoulder. Or you can do a relaxation of the shoulder. Breathe in, pulling it down. Breathe out. Breathe in, breathe out. But the most powerful of asthma is combining all three. Do a prayer pose to the back, or you can do it from the front, you see better. Put your hands to the back and put it together as a prayer pose. We call it Paschim Namaskar. All of you have seen me doing it before. This is your Paschim Namaskar. And stay here a little longer and longer. As you know, close your eyes, be sure there is no pain and your effortless breathing. Paschim Namaskar relaxes all the muscles of respiration, and as you know, the muscles of respiration are voluntary muscles. That means it can be trained. So it's like your weight training. You can do weight training with 10 pounds, 15 pounds, 20 pounds. Keep on increasing it based on your neuroplasticity or habit forming, same way. We can breathe out first. We can breathe in with a count of 3 in, 6 out. Count of 4 in, 8 out. Count of 8 in, 16 out. We can even do a count of 10 in, 20 out. And they're completely effortless. When you breathe, people even don't know you're breathing. Then you incorporate your Brahma Mudra, the movement of the neck, relaxation, with exhalation, sound of a bumblebee. See, you don't want asthma people to start doing the breathing practices because they have an inherent, a built-in fear and anxiety to breathe, and they're not going to do it. So here my hand is back, I teach them. You'll be breathing out first, take a deep breath in and breathe out with the sound of a bumblebee with the 4 movements of the neck. Breathe out first. A slow deep breath in and drop your neck to the back. And then during breathing out, we use the bumblebee sound. When you do your pranayama practice and breathing, when you get a coughing, it's entirely normal. Because the cough comes from your larynx, the vocal cord, and when you are doing your real exchange of air through the perfect respiratory tract, you do get some irritation in that air from the air. Turning your head to both sides and again to back without turning your shoulder, and then slowly turning your head all around. Same component with your bumblebee breathing. Breathe out first. Deep breath in. Look all the way to the back without turning your shoulder. Turning your neck to the left, to the back, to the right, and then right to the back, to the left. Now you'll see your breathing will be a lot more effortless. Another relaxation response, very powerful, as you know, all of it, keeping your spine straight. Merudandachal, stand along the wall, Dandasana, keep your hold, another called Jastyasana, keep your body like a stick all the way connecting to the wall. Uttadasana, mountain pose, keep your spine straight. Every time, all the time. I'm going to show you a few asanas for a hand strength. Actually, I have not done in a while, but okay. Hand strength is very important, and I do it. You know, it's not that I don't do it. I do it quite often, but as I said, there is nothing called a difficult asana. It is all your neuroplasticity and practice. A simple hand strength will come from your able to place your hand grounding. Like if you put your hand, like you say, your downward facing dog. If you put your heel to the ground and hand to the ground, it is a very powerful tool for the hand strength, hand grounding. Very important for respiratory function. Or you can do a little simple push-ups, and then you can come back on Hanuman asana. Tulasana. Tulasana is good. Go a little bit in the front, maybe. Sitting here. Get into Padmasana, lotus pose, which we go in stages. We start with the Sukhasana, Siddhasana, Padmasana. Even the Sukhasana, if you sit down in an easy pose, here, touching your index finger and thumb, closing your eyes, and simply chanting Om. Om, 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 Om. Wonderful way to quiet down the mind. In a Tulasana, you get into a lotus pose, Padmasana. These are primarily your hand strength. Asanas, as I said, you start doing your relaxation responses, parasympathetic activation, and a set of pranayamas for your asthma patient. Vastrika, bellows, Kapalbhati pranayam, breath of fire. This Kapalbhati pranayam is your very relaxing. Bastrika is called Prano Pradhan Pranayama. That means it improves your prana, the life force. Kapalbhati Pranayama is called your Agni Pradhan Pranayama. It ignites your Agni. And the Anulom Vilom Pranayama, alternate nostril breathing, is called your Vayu Pradhan or Vata balancing. And Vata is the main reason for your asthma. Asthma even is tridroshic Ayurveda, but it's primarily a Vata disorder. Put your hands here, raise your body high up. Your body is only supported by your two hands. Tulasana. Oh, my hand, wrist hurts. No, wrist don't hurt. Why? If wrist hurts you, don't do the Tulasana. If wrist hurts you, pain comes from a tightness. So relax your wrist first. Not one day, not 2 days. Keep doing it until the wrist pain goes away. Once the wrist pain goes away, then you do this hand strength asanas. What next? Crane, Bakasana. So do Bakasana. Okay. Your hand strength. Hand. Both the hands. I'm going to show it to you. I'm just going to show it to you. When I practice, I stay a little longer. So have your support with the feet and slowly it's going to go high up and stay high up. And stay. I can stay also, but looking at the camera is hard to continue. Anyway, so you know the technique. Crane, Bakasana. Murasana, peacock pose. Everybody comes and tells me, this is so difficult. How can do it? I said, you do it with the effortless breathing. You do it when you're doing it. You are singing. You are even you're talking. You are singing. Put your body weight on your elbows. Push your body in the front. And your whole body will go high up. Don't try to get your feet up. push your body in the front, your feet is going to go high up on your own. So have your hand, and if you put your body weight and push your body in the front, then your feet is going to go. If you try to raise your feet, it's not going to go high up. Mayurasana. Mayurasana, we call it a female version of Mayurasana. Lotus pose first, Padmasana. You do Mayurasana and Padmasana. Same way, put your body weight, elbow, push your body in front, and your body will go high. Don't try to lift your lower part. Lower part will get lifted when you push your body in the front. And then able to get up without a support is a wonderful, wonderful technique to improve your body's health, well-being, and primarily also breathing. From here, you get up without a support. For pranayama practice, you'll be amazed if I tell you first, you check the patency of your nose. Even when you do a jalneti, when you're doing it, you'll see the flow through one nostril is little less than the other. Every 90 seconds, we change our nostril. So close one nostril, closing my right nostril. Breathe in and out through your left nostril. Left nostril is clearly open. Close your left nostril. Breathe in and out through right nostril. But both the nostrils are quite open except the right side may have a little bit. Try on you. You'll see how one side is better open than the other side. Then you do alternate nostril breathing. And first you start doing the bellows Bhastrika, but asthma people, please don't try very faster Bhastrika. Do breathe out first. Slowly get high up and breathing out, you put your Adhimudra. This is a technique, continue for a while. Or see. Okay. Another one is the Bhastrika Pranayama. Do it very simply, gently for asthma people. Sit down with the spine straight. Do your Adhi Mudra in your hand, and you start slowly and rapidly without raising your hand, just moving your shoulder very gently. So just simply take 200, and I'm talking, I'm breathing, absolutely no issue. If we practice so much, we let the asthma people and including myself do 600, 800, even 1,000 of this. Kapalbhati Pranayama, very slow Kapalbhati Pranayama. As you know, Kapalbhati Pranayama, pushing the belly inside and then and do with all these mudras. If you go to my pranayama practice, you'll be able to see how the Kapalbhati Pranayama is done with different mudras. But for asthma, we also recommend a little called your breath holding in inhalation, Abhuntarin Kumbhak, with your chin lock, Jalandhar Bandha, which in a sense called your Murcha Pranayama. Murcha Pranayama, Murcha means almost unconscious. It is so relaxing, make you feel like and also breath holding, you practice it very gently. People always come and say, oh, should we do breath holding? Breath holding is very dangerous. Breath holding raises the blood pressure. No, you do everything as if it is a normal breathing. And slowly the pace will go higher based on your neuroplasticity. Dhyana Mudra or Gyana Mudra. Breathe out first. Take a slow breath in. Hold your breath and then use a chin lock or Jalandhar Bandha. Hold your breath and keep counting. Give 1 and a 2 and a 3. Murcha Pranayama. For a meditation, a practice, you do your uh, alternate nostril breathing with without closing your nostril. You have seen me doing it many times, because what happens when your mind quiets down, you able to breathe in and out and control your breathing. It's not very difficult. It's very simple. And what you do, you touch your index finger, bring your awareness to your nostril. You breathe out through your left nostril. And you breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Continue this with your eyes closed in silence for some time, and you will see you'll enter into a profound level of relaxation and mind control. Then you're able to do all the pranayamas, all the asanas for asthma. Asthma, as I said, lifestyle-related disorders. You start with your dinacharya, daily routine. Again, going over through tongue scraping, jal neti, called neti pat. Then your sutraneti with your red rubber catheter, your quieting down the mind, mudras, chanting, Paschim Namaskar, Bhramri Pranayama, neck relaxation, hand strength, very important, hand strength, and all the sets of pranayamas. Bastrika, Kapalbhati, alternate nostril breathing, Anulom Vilom Pranayama. Your also what helps in your lung is called your Ujjayi Pranayam and Shankha Pranayam. Let me finish with those two. A Shankha Pranayam is a forceful, exhalation against resistance. Ujjayi Pranayam is a resistive inhalation. There is a resist, then you inhale, and Shankha is a resistive exhalation. And when I do the Ujjayi Pranayam, I'll incorporate Ujjayi Pranayam with a chin lock and a left nostril breathing. Left nostril breathing is called your Chandranari. Very relaxing, quieting, wonderful for asthma. So what you do, generally in a blowing a conch shell, that's called your Shankha. Shankha is a conch shell, Shankha Mudra. So you don't have a conch shell with me. I do have a conch shell, but I don't know if you have seen the conch shell, but you can put your hands in a Adhi Mudra, put one in the top. Generally, we don't breathe through your mouth. We do all the breathing through our nostril, but so we can do some exhalation or some breathing technique through our mouth. So Sitali Pranayam, Sitkari Pranayam, the Shankha Pranayam. We'll be breathing out first, breathe through our nostril and breathe out through your mouth against resistance. Breathe out first. Deep breath in. I've been talking to you for so long, even now my mouth is still wet. I have a lot of saliva in my mouth. Why? It's a parasympathetic activation. A sympathetic activation dries up your mouth. One more time. Breathe out first. Take a deep breath in. Oh, you want to see one of the youngest yogi just arrived here. Okay, come in. No, let's do some yoga. Let's do some yoga here.
No.
Yeah, come on.
That's right.
Come on here. Do some yoga here. No? Okay. Bring it. Can you do some yoga here? Okay. Let me see some yoga. Okay. What pose? Downward. Downward facing down. Down, down.
Down, man.
Yeah. Let's do down, down. Ajo. Ajo. Come on. Down, down.
Like this.
Oh.
Do you do it? I don't do it.
Class teacher?
No. Still classes. She's teaching the class now. No yoga today? Okay.
Do
Say
tree
bye-bye.
pose? Can you do tree pose?
Can you tree pose?
Like this?
Tree pose?
Can you do this?
She's thinking. She does yoga. She does yoga every single day. So, at home and in school. Yeah, people are watching you.
Can we do pose like this?
Or you can touch. Can you touch the wall? Hey, touch the wall and do this. Tree pose.
Down towards dog. Or
And down dog.
down.
No, she's not ready. Okay. Say bye bye.
Not even.
Bye-bye.
Bye bye. Bye bye.
No.
Okay. So, what is interesting is my granddaughter, 2 years old, and I'm teaching her yoga. In fact, actually my daughter is also a certified yoga teacher. We've been teaching her almost from the day one. The day she can do, today she was probably not comfortable in the camera. She will do perfect down dog. She'll do perfect cobra pose, perfect tree pose, even in the 2 years old. It's amazing, that whole how do they yoga, and they do it again in the school every day. So let me finish. The finishing is your resisted inhalation, called your Ujjayi Pranayam, with your chin lock, okay, and the left nostril breathing. So all three combines, prepares the most relaxing of the practices for asthma. So Ujjayi Pranayama is a slowly closing your larynx and trying to breathe in. What it does, larynx is supplied by your superior and inferior laryngeal nerve. It is a branch of vagus nerve. So what do you do when you slowly constrict your larynx? It activates the vagal nerve. The chin lock, it activates your carotid sinuses, and left nostril breathing is controlled by the right brain, which is cooling, intuitive, and female. So here is the practice. Cannot have a better practice than this in a patient with asthma after the slowly gets quieting down their mind. It's a daily practice, and you incorporate the daily routine, especially Jalneti, Sutraneti, and also called oleation of the nostril. There's another thing we have from our experience to find out, and also it's one of the yoga tradition, is that when you sleep at night, generally, as you know, we all sleep on the left side. Sleep on the left side, the right nostril opens up. It is a heating component, Suranari, and the right side is the inferior vena cava, get a venous return. And you can look at my sleep, yoga therapy for insomnia and sleep apnea, you will see all this stuff. So at night, what we do, this is really a personal practice, very gross. We dip into a little finger in oil and we put the little finger inside the nostril and we oleate the nostril. At night, what happens, if you don't have enough humidity at your room, your little mucus dries up and there is a obstruction, and the people with asthma gets an exacerbation. They feel very uncomfortable at night. By oleating the nostril before going to bed, it's a wonderful technique. So you can go back to see my yoga, or the daily routine yoga therapy. And thank you for joining. I'm sorry, granddaughter who actually just showed up today and shows up the yoga all the time. She's not in a good mood today probably. Anyway, thank you. So again, if I'm in town, I will be here. No question about it. Probably next Saturday I'm here, and it will be based again on your request. And then again, any comments, any questions, please put it here. We'll be glad to do it for you. Thank you for joining.